Multiple sclerosis symptoms are not usually urgent, but there may be instances when you need care right away. Welcome to Ask an MS Expert. I'm John Strum, your moderator and host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Today, I'll be asking our expert the questions you want answered. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators will be online throughout today's live program, answering those questions and connecting you to resources. When MS symptoms intensify, it can be difficult to know if you need immediate medical care. Joining us today is Dr. Kalina Sanders, who will help us understand what to look for when MS symptoms worsen and how to determine if a trip to the hospital is necessary. Dr. Sanders is a board-certified neurologist who specializes in multiple sclerosis and spasticity management at Baptist Neurology in Jacksonville Beach, Florida. Dr. Sanders holds relationships with commercial interests with Genentech, TG Therapeutics, and Bristol Myers Squibb. Welcome, Dr. Sanders, and thank you for being with us today.
Thank you, John. I'm excited to be here.
Well, let's dive right in. What situations might require immediate medical care for people with MS?
There are three situations. First, there are issues that are a direct consequence of multiple sclerosis, specifically a relapse. Second, side effects of certain medications that we use to treat multiple sclerosis will sometimes require urgent attention. And then thirdly, there are issues that are an indirect consequence of multiple sclerosis or related to the therapies that we use. Most specifically, infection complication. These can also result in the need for immediate care. In addition to those MS-specific problems, any symptoms that could indicate other diseases, such as a heart attack or a stroke, also require immediate attention and might require you to call 911.
I just heard you mention relapses. What exactly is an MS relapse, and how does someone know whether they're experiencing one?
By definition, a multiple sclerosis relapse is a new or significantly worsening neurological symptom. That could be an acute loss of vision or new onset weakness on one side of the body or numbness that you've not experienced before. But sometimes people can have old symptoms that resolved and maybe returned. And in general, those symptoms will last at least 24 hours in the absence of a fever, overexertion, or an infection.
We just heard from Kelly, who's wondering how she would know if a relapse requires immediate emergency room care or if her neurologist can handle it in their office.
Oftentimes, it is dependent on the severity of the symptoms. Although I do advise my patients to let me know for anything that they may be concerned for a relapse. And we can have that discussion and determine whether or not immediate hospital care is necessary or if it's something that I can handle either through telemedicine, through the telephone, or bring them into the office. But in general, I tell most of my patients that if the symptoms are severe to significantly impact your function, particularly if your mobility is impacted, you're unable to walk or you're unable to see out of the eye, then those are times where we might want to bypass the office and go for more immediate care.
Bella wants to know what to expect if she goes to a hospital for an MS relapse. Would this mean staying overnight, or would she just be treated and sent home?
That also depends on the severity of the symptoms. Most people, when they are going to the hospital, they have to go through the emergency room. So they will oftentimes be evaluated by an emergency room doctor who may or may not be familiar with the impact of relapses on MS. If the emergency room provider has any additional concerns, they may consult a neurologist when you're in the emergency room. Now, unfortunately, in all systems, that neurologist may not be your MS neurologist. They may be a what we call a neurohospitalist, but oftentimes they are more familiar with the impact of relapses on multiple sclerosis. So you would be evaluated. You may undergo some additional laboratory assessments, particularly looking for infections, because oftentimes things like urinary tract infections or other viral infections may be the culprit. Now, if the emergency room provider or the neurologist feel that you require additional care, that might prompt you to be admitted to the hospital. Generally, if the relapse is severe and it requires intravenous or IV steroids, then oftentimes that might require an overnight or multiple night stay in the hospital.
Derek is wondering what the difference is between a pseudo relapse and a relapse, and he wants to know how he can tell the difference between the two.
So, a pseudo relapse is oftentimes worsening of prior symptoms that previously subsided or resolved that occurs in the absence of being overheated. And that can be due to physical exertion, that can be due to infection, that can be due to fever. So, oftentimes in those instances, when your core body temperature increases, it impacts how the nervous system electrical signal communicates, and that can bring out symptoms. Usually, with a pseudo relapse, if you cool down, you rest, you hydrate, your fever comes down, those symptoms improved. And that would suggest that this is a pseudo relapse. Now, a true relapse, which is an indication of a new inflammatory attack to the central nervous system, these symptoms will come about in the absence of being overly exerted or overheated. And oftentimes, those symptoms will not resolve even if those precipitating features or factors go away. And so sometimes it's a wait and see if your symptoms resolve with changes in your fever or changes in your hydration. And if they don't go away, then that might be an indication that this is a true relapse.
Are there ways that someone can prepare for a relapse?
Unfortunately, with multiple sclerosis, it's an unpredictable disease. And so oftentimes, despite everything that we do to help to prevent a relapse, and that might include being adherent to your disease modifying therapies, engaging in healthy lifestyle practices, a relapse can occur. But I think the best way to prepare is to do those things to lessen the risk, but also understand that if a relapse were to happen, the impact that it might have on your daily life, your family life, and your occupation. So one of the things I think is important is if you are employed, you want to make sure that you have FMLA or the Family Medical Leave Act set up so that your job is protected should you have a relapse. If you are the primary caretaker of your children, you want to make sure that you have alternative care to help you and the resources and to support to help you should you have a relapse. And I think those are the two main things that, or the three main things I should say, that we should be focusing on in order to prepare for a relapse.
Jillian reminds us that numbness, weakness, confusion, and trouble seeing are all signs of a stroke that would require immediate medical attention. She wants to know how to tell the difference between a stroke and the symptoms of an MS relapse.
That's a very good question because obviously a stroke and multiple sclerosis both impact the brain, and there are similar symptoms between them. The main difference between a stroke and MS is the acuity of the onset, how fast the symptoms come and reach their maximum effect. So with a stroke, because it's oftentimes due to a blocked blood vessel with loss of blood flow and oxygen to a particular area, or sometimes bleeding in that part of the brain, the onset of the symptoms is very acute. It is oftentimes within seconds, and it is oftentimes the symptoms are maximized within minutes. That's a little bit different than what we commonly see with an MS relapse. With the MS relapse, oftentimes the symptoms will have a somewhat subacute or gradual onset that might worsen over the course of hours or a day. So a person may wake up with numbness in the fingertips, and an hour later it's in the arm, an hour after that it's down the leg. So it's how the symptoms behave that helps us to tell the difference between a stroke and an MS relapse.
While we're talking about stroke, what are some risk factors associated with stroke that would put someone at greater risk of experiencing one?
The primary risk factors for a stroke include high blood pressure, high cholesterol, diabetes, obesity, and an irregular heartbeat such as atrial fibrillation. Now, having multiple sclerosis unfortunately doesn't mean that you can't have those other comorbid conditions. So it is important that you are evaluated and monitored for those things.
Many prescription medications carry side effects. Which of those medication side effects might require immediate medical care?
The primary reason or medication side effect that might prompt a person to go to the emergency room is an allergic reaction. An allergic type reaction will oftentimes occur immediately after the administration of the medication, but sometimes can also be delayed. Severe reactions such as throat swelling, shortness of breath, a rash that involves a large part of the body really should be evaluated immediately by calling 911 or getting to the emergency room.
Tony said he's heard that some medications used to treat MS can lower a person's immune response to viruses and bacteria, which may increase the risk of infection. He wants to know whether that's true and what are the steps that someone should take if they have symptoms of an infection.
Given that multiple sclerosis is an autoimmune disease, Tony is correct. Our disease modifying therapies do either alter how the immune system function or decreases or suppresses some of our immune cells. And what is known in the clinical trials with all of our disease modifying therapies, that one potential side effect is infection. Oftentimes, the risk for infection includes urinary tract infection and upper respiratory tract infection. The main thing that can be done to help to prevent infection is general hygiene. I encourage all of my patients to be very diligent about washing their hands, avoiding, say, contacts if possible. But if they are developing signs and symptoms of an infection, they should engage not only with their neurologist, but also with their primary care doctor who have the resources and the ability to treat their infections appropriately.
Aisha said her mom lives with MS. She uses a wheelchair and she's predisposed to developing pressure sores. Aisha's wondering how to prevent pressure sores and what the signs are that someone needs immediate medical care for them.
Unfortunately, with the disabling aspects of multiple sclerosis, this is a real possibility for a lot of our patients, particularly if they're less mobile, as Aisha's mother who is in a wheelchair, or there are some that are more confined to the bed. The pressure without being able to move can sometimes worsen into an infection. And that infection can oftentimes be superficial or it can get deeper and even impact the bone, and people can develop osteomyelitis or an infection there. The best way to prevent pressure sores is to keep moving and alternate where you are placing the pressure. So, as in her mom, if she is primarily from the wheelchair, you want to make sure that she is shifting from side to side so that she can balance the pressure. There are also certain cushions that can be made for wheelchairs that also help to relieve some of those pressures. If the MS patient is unfortunately confined to the bed, it is important that they are also rolled and change positions throughout the day to help to prevent the pressure sores. Now, if the pressure sores become deep or infected, that is when they should seek medical care for them right away.
Lee tells us they have a neurogenic bladder and they're prone to urinary tract infections or UTIs. Can you explain what a neurogenic bladder is, how to recognize if a UTI requires a trip to the hospital, and maybe how to prevent future UTIs?
The nervous system provides electrical communication to the bladder. So, having multiple sclerosis can impact that communication, which results in a dysfunction of the bladder. There are really three main ways the bladder is impacted by multiple sclerosis. Sometimes patients develop what we call a small spastic bladder, where as soon as any urine comes in, the bladder wants to get rid of it. And oftentimes that results in urinary frequency or incontinence. Another way MS can affect the bladder is that they can develop what we call a floppy type of bladder, where it just kind of collects urine and doesn't want to release it. And those patients can develop retention. So they have difficulty with eliminating their urine. Now, it's those patients that have retention where that they are in higher risk for having a urinary tract infection. The third way multiple sclerosis can affect the bladder is it can have the inability to contract when the sphincter is open, or it's dyssynergic, so they're not in synergy, and that can also result in retention. So I like to describe urinary tract infections, particularly in patients who have urinary retention, as a pool of water. If we let a water sit on the outside, that they're more likely to attract things like mosquitoes. And the bacteria is very similar. So if the bladder is holding a lot of urine and you're having difficulty eliminating it, then you're more prone to get bacteria in. If someone develops a urinary tract infection, the main symptoms include pain with urination. Oftentimes, they do have frequent urges to use the bathroom, and some people can even have bleeding in their urine. If any of those symptoms are there, it is important that you contact your primary care doctor and or your neurologist. Now, immediate care in a hospital setting is when that infection starts to impact other areas of the body. So many times people can become what we call septic, where that infection is now spreading more into the blood. And that might result in changes in their awareness, or they may become more confused, or there is worsening of their MS symptoms. I think that is when immediate care to a hospital is important. And these are oftentimes associated with fevers as well. That also requires immediate attention as well. Now, to
Mo-
prevent a urinary tract infection is really a matter of healthy urinary habits. So if you have retention, you want to make sure that you are emptying your bladder. That might be due to different exercises that you can do, such as Kegel exercises that can, you might also require external pressure to empty the bladder. And for those patients that really have severe retention, it might require self-catheterization. But you always want to make sure, though, that the area is dry and as clean as possible.
Most viral infections like COVID-19, the flu, RSV, and pneumonia don't need urgent care at the hospital. But what are signs that a viral infection is more serious than normal and may require immediate medical care and treatment?
Very similar to the urinary tract infection. If these viral infections appear to be more systemic or affecting your level of consciousness or awareness, or if you are having severe fevers or trouble breathing. So, with the respiratory viruses such as COVID-19, flu, and RSV, I think the main concern is the health of the lungs. And so, if you notice that you're having shortness of breath, if you're having coughing to the extent that you're having difficulty breathing, or many people now have in their home the oxygen monitor. And if you have that and you're using the oxygen monitor on your finger and you're noticing that your oxygen levels are low, those are times when you need to seek immediate medical care.
Last year, Judy experienced 2 falls that required hospital visits. She's wondering if you have tips for recovering safely from a fall, and I'm hoping you'll also share some ways to reduce falls both in and out of the home.
Falls are another potential complication from having multiple sclerosis due to imbalance issues as well as weakness. Recovering from a fall obviously depends on if there was a significant injury or impact from the fall. If it's a fall that you have minimal or very little injury, then that might require resting, getting off of the limb that, or not using the limb that was injured. Many times when people fall, they're sticking their hands out, and so they injure their or sprain their wrist, or oftentimes it's the leg. Mild injuries might require rest, ice, and having that discussion with your primary care doctor and or neurologist. Now, more severe injuries, particularly head injuries, if you fall and hit your head, whether or not you lose consciousness, whether you lose consciousness or not, you do want to seek medical care more urgently for those types of injuries. And obviously, if you have pain that's severe, particularly with moving a limb, that might be an indication of a fracture or a breakage in your bone. Those are things that you do want to seek immediate medical care for because that might require additional evaluation and treatment. And so it really depends on how severe the injuries are, if any, as a result of the fall. But I agree, John, the best way I like to approach falls is to prevent them. And so some of the main ways I think it's important to prevent falls is obviously being cautious when you're walking, particularly if you have rugs or things that are in your path within your home. You want to make sure that those are removed and you have a nice clear surface when you're walking in your house. If you have significant mobility issues, you want to use your assistive devices. Those assistive devices can be a cane, a walker, or even a wheelchair to help to prevent those falls. Now, if you're using those things, you're being cautious, you've cleared your pathways, and you're still having significant balance issues and falls, oftentimes I would recommend utilizing things like physical therapy to help either coordinate your balance a little bit better or improve in the weakness that you're having.
Kyle says he knows he'll feel panicked and he'll probably be pretty disorganized if he ever has an urgent medical situation. What are some ways Kyle can prepare for this type of experience that are going to keep him staying calm?
I think the main way is to have a plan, right? If you have new symptoms, you want to make sure that you know how to contact your neurologist, and have that discussion with them on the next steps. I do think that it is important to stay calm because oftentimes with increased anxiety or panic, that may worsen the symptoms that you're having. The other thing I think is important to do is to evaluate and make sure you don't have signs and symptoms of an infection. Again, checking your temperature if you have that ability, looking for things like the urinary tract infection. But the goal, I think, to help Kyle remain calm is to have that plan. And you want to have that discussion with your neurologist before it happens. So I oftentimes get asked, if I have a relapse, do I call you? What if it's after hours or if the clinic is closed? How do I get care then? And so each clinic and each provider may have their own policies on what to do after hours, but it's important to have that game plan set up before it happens.
Are there any tools that might be helpful to someone like Kyle?
There are a lot of different resources that are available. One that comes to mind is the medical alert bracelet. Many times people have the fall alert buttons that they can wear across your neck. And even in our high-tech era, we have our Apple Watches that can detect things like falls and can alert other people when that happens. Letting others who are commonly around you know of what your vulnerabilities are, and that they can also be a second set of eyes to give you an idea of what is happening to you.
Well, you shared some really helpful information about knowing when it's time to seek immediate medical care for MS. What would you say is the top takeaway that you'd like our viewers to remember and use?
I think the main two or three takeaways that I would have for you is to one, know what is normal for you and know when, if it's not normal, how you can access the resources that you have. Again, you want to make sure you have that game plan with your neurologist should new symptoms occur, and then have a discussion with your neurologist and primary care doctor on how to manage infections. I think communication is probably the biggest takeaway that we have when it comes to managing relapses so that you feel safe and comfortable with what you need to do.
Well, thank you for being with us today, Dr. Sanders.
Thank you, John. I enjoyed it.
Today's program survey has now been posted in the chat for your feedback. Please take a minute and complete it to help us create programs and topics with you in mind. Please be sure to visit the Society's website for information and resources on MS, connection opportunities, and ways for you to get involved. You can also connect with an MS Navigator to receive personalized support by phone, email, or through the Society's website by chat. A recording of today's program will be posted on the MS Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. Finally, I'll invite you to join me each week on the Real Talk MS podcast, where we continue the conversation that we start here. You can find Real Talk MS on Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Thanks for joining us for Ask an MS Expert, and we'll see you next week.